In this video, I explain tips for better sleep. Watch this full video. 1. Stick to a sleep schedule. 1. Consistency. Aim to go to bed and wake up at the same time every day, even on weekends. 1. This helps regulate your circadian rhythm, your body's natural sleep-wake cycle. 2. Adjustment period. If you need to change your sleep schedule, make adjustments in small increments, 15 minutes earlier or later, each day rather than drastic changes. 2. Create a relaxing bedtime routine. 1. Wind down. Engage in calming activities an hour before bed. 1. This signals your body that it's time to prepare for sleep. 2. Activities. Consider reading a book, taking a warm bath, listening to soothing music, or practicing relaxation techniques like deep breathing, progressive muscle relaxation, or meditation. 3. Optimize your sleep environment. 1. Comfortable bedding. Ensure your mattress and pillows are comfortable and supportive. 1. Replace them if they are old or causing discomfort. 2. Room temperature. Keep your bedroom cool, typically between 67 degrees, 19 degrees. 3. Darkness. Use blackout curtains to block out light. 3. Consider an eye mask if blackout curtains aren't an option. 4. Quietness. Use earplugs or a white noise machine to drown out disruptive noises. 4. Soft background sounds like a fan or white noise can help some people sleep better. 5. Air quality. Ensure good ventilation and keep your room clean to avoid allergens that might disturb your sleep. 4. Limit exposure to light before bed. 1. Screen time. Avoid screens, phones, tablets, computers, TVs at least an hour before bed. 1. Blue light from these devices can inhibit melatonin production, the hormone that regulates sleep. 2. Blue light filters. If you must use devices, use blue light filters or night mode settings to reduce blue light exposure. 5. Be mindful of your diet. 1. Caffeine. Avoid caffeine found in coffee, tea, chocolate, and some medications at least 6 hours before bed as it can interfere with sleep. 2. Alcohol. While alcohol might make you feel sleepy, it can disrupt your sleep cycle and decrease sleep quality. 3. Large meals. Avoid heavy or rich foods within a couple of hours before bedtime. 3. They can cause discomfort and indigestion, affecting your ability to fall asleep. 6. Get regular exercise. 1. Timing. Regular physical activity can promote better sleep. 1. Aim to finish any vigorous exercise at least a few hours before bedtime. 1. Gentle exercises like yoga or stretching can be done closer to bedtime. 2. Routine. Even light exercise such as walking for 30 minutes can improve sleep quality. 7. Manage stress and anxiety. 1. Relaxation. Technique. Practice relaxation technique like deep breathing, meditation, or mindfulness. 1. These can help reduce stress and prepare your body for sleep. 2. Journaling. Writing down your thoughts before bed can help clear your mind and reduce worry or stress that might interfere with sleep. 8. Avoid naps. 1. Nap timing. If you need to nap, keep it short, 20-30 minutes, and do it early in the afternoon. 1. Napping late in the day can make it harder to fall asleep at night. 9. Exposure to natural light. 1. Daylight exposure. Spend time outside in natural sunlight during the day. 1. Natural light helps regulate your circadian rhythm. 2. Morning sun. Morning sunlight exposure is particularly beneficial in regulating your sleep-wake cycle. 10. Be mindful of fluid intake. 1. Hydration. Drink enough water during the day, but reduce fluid intake in the evening to minimize nighttime bathroom trips. 2. Timing. Stop drinking liquids 1-2 hours before bed. 11. Create a sleep-inducing environment. 1. Aromatherapy. Use essential oils like lavender, chamomile, or sandalwood in a diffuser. 1. These scents have calming effects that can promote relaxation and improve sleep quality. 2. Routine. Incorporate aromatherapy into your bedtime routine to signal your body it's time to sleep. 12. Consider professional help. 1. Sleep disorders. If you have persistent sleep problems, consult a healthcare professional. 1. Conditions like sleep apnea, restless leg syndrome, or chronic insomnia may require specific treatments. 2. Sleep studies. A sleep study may be recommended to diagnose underlying sleep disorders. 3. Cognitive behavioral therapy for insomnia, CBTY. This therapy is highly effective for treating chronic insomnia and focuses on changing thoughts and behaviors that affect sleep. Implementing these tips consistently can help improve your sleep quality, leading to better overall health and well-being.